St. John. I'm the grad assistant of this program, and today Miss Tonia Grimsley is going to introduce herself, and she's going to be talking about the American Heart Association and specifically around the Eastern North Carolina area.
Hello. Good thing is y'all all know me, so I don't really have to give a huge intro. But for those that are listening to the recording later, I'm Tonia Grimsley, and I work for the American Heart Association in Eastern North Carolina. I'm a development director, so I staff some of the heart walks and heart balls that we have in the area, but I'll talk about that later. Also work here at Wesleyan. I started as the cheer coach originally, still am. But I also teach in the public health department. So I get to live, breathe, do public health all day, every day. And it's something I'm really passionate about. But the mission of the Heart Association aligns really greatly with what we do in the public health department at Wesleyan. So this is a really cool opportunity to get to talk about how my worlds collide and what we do. I think the biggest thing that we get at the Heart Association, especially in rural Eastern North Carolina, is that it is a big corporate organization. So when people see American Heart Association, they don't always see the local work that we do. And being from here, I know that that's really important to people. So that's what we're going to talk about today. I'm going to share my screen and let me know if you can see it. Can you see it? Cool. Perfect. Okay. So I'm going to talk about our story, what we do as a national organization, and how that trickles down all the way to Rocky Mount, North Carolina. So I've been with the Heart Association now it will be 5 years in August. I have been in the nonprofit world since I graduated from college. I started originally at the American Cancer Society, and when COVID happened, obviously the nonprofit world took a big hit, as you can imagine, in the fundraising world, because people aren't fundraising when there's a pandemic happening. Obviously, there are things that are a lot more important than raising money. So things took a turn, and I ended up at the Heart Association, and I absolutely love it. I'm absolutely obsessed with my job. I'm blessed to have two jobs that I'm so super passionate about. Excuse me. And that I get to work with people every day that are also passionate about the health of people, especially in Eastern North Carolina. Those are my people and who I care about. So the mission of the Heart Association is to be a relentless force for longer and healthier lives. That's something I say all the time. People also think, when they think the Heart Association, oh, heart attack, that's it. And it's so much more than that, especially at the local level. We'll talk about what our kind of highest priorities areas are. But that's our overarching mission. And then our vision is to advance health and hope for everyone, everywhere. We have recently done a really big push on rural health, and that is a trend that's going to continue because, as we'll see later in the presentation, life's different here. It is very different in Rocky Mount than it is in Raleigh. I live in Tarboro. It's very different in Tarboro than it is in Rocky Mount sometimes. So the basis is that people are different and where they come from is different. So public health is health of the public, the people that live everywhere. So that's a big mission and vision for the American Heart Association. So here are just some facts about cardiovascular disease. Obviously, it's the #1 cause of death in the United States and in the world. In Nash County and Edgecombe County, if you look at the community health needs assessment every year over year, this is something that we're facing. And there's many reasons for that. Around here, we don't eat healthy. And there's a few reasons for that as well. I mean, it's expensive to eat healthy. You can go to Wendy's and get a 4 for $4. That's 4 fried foods for $4. But if you get a salad, that's going to be $14 to eat something remotely healthy. So if you're on a budget, what are you going to do? You're going to go get the 4 fried things that feed your family versus getting a salad that's more expensive. So there's a lot of underlying things that cause the number of cardiovascular disease deaths to rise. 127.9 million people in the United States have some form of cardiovascular disease. This stat is ridiculous. That's the population of California, Texas, Florida, New York, and Pennsylvania combined. And the crazy thing is that it's largely preventable. Yes, genetics plays a huge factor in it as well, and sometimes it is unavoidable, but there's a lot of behaviors that we can control that lead to heart disease. So that's something that we're going to talk about too. And then we know that 19 million people die worldwide from cardiovascular disease, which is like losing half the population of Canada every year. Unreal. So the kind of framework that we go by at the Heart Association is called Life's Essential 8, and it breaks it up into 8 things. So 4 of those are behaviors that you can do to try to prevent cardiovascular disease, and then 4 of those are things that if you've been diagnosed with cardiovascular disease that you can do to try to limit how bad it is, pretty much. So the 4 things that you can control: eating better, be more active, exercise is medicine, walking, that can make a huge difference, just walking more. Don't smoke, don't do tobacco. I think that's something that I feel like smoking is a little bit more outlandish now, but vapes are everywhere. There hadn't been enough studies done, and they haven't been out long enough to know exactly how bad for you they are. But we know that your lungs are not supposed to take in that kind of thing. So obviously it's not good for you. Getting healthy sleep, that's one that we've added recently. It used to be Life's Essential 7, and we've done a lot more studies on sleep lately, showing that that's a behavior that you can control that helps you be more healthy. And then if you are diagnosed with cardiovascular disease, the 4 things that you can do to try to manage your risk factors and make it a little bit not as bad, I guess, or is managing your weight, control your cholesterol, manage blood sugar, and manage your blood pressure. So knowing your numbers. These are 4 things that you can do for that. Another part of the American Heart Association is the Stroke Association. So again, like I said, when people think about the Heart Association, they think, oh, heart attack, that's it. But there's just so much more that we do. And a lot of the risk factors are the same. So your blood pressure is the #1 cause of having a stroke. So if you can manage your blood pressure, can we keep you from having cardiovascular disease? Can we also keep you from having a stroke at some point? These stats are in the United States, someone dies of a stroke every 3 minutes and 11 seconds. So it's 12:14. I've been on this call for 14 minutes. So let's say in the time we've had at least 2.5 people die of a stroke since I've been on this call. That's absolutely ridiculous. And we know that stroke accounts for approximately 1 out of every 20 deaths in the US. So it's something that we're paying attention to. At one point, Edgecombe County was #1 for strokes in the country. So our hospital systems are really working on paying attention to that. They have stroke coordinators trying to figure out why it is that that's happening. And then we have this video that I'll show you. There's no sound, so you don't have to come off and be like, I can't hear it. It's just background noise. But it teaches about strokes. This is just a quick little tidbit that I'll show you. Can you see it? Yes. So that's just a little tidbit about stroke. I will say that an interesting thing that we come across a lot in the Heart Association is, like, for example, I know a guy, we're featuring him at Heartball, and he's like, I got this. I gave him a little sticky note that has the warning signs for stroke, the FAST on it. And he said, I didn't have any of these symptoms when I had a stroke. He thought he had vertigo. And it's a testament to knowing your body. You are your body's biggest advocate. So if something feels off, go to the doctor. And thankfully he did, and he has no deficits. But this is just kind of a framework. This is not what happens in all cases, but in a majority of them, it does. So if you know FAST, face drooping, arm weakness, speech difficulty, time to call 911. The biggest thing is calling 911 as quickly as you can, because then EMS can come quicker and they know what to do in this case. We also have Rapido, which is the same thing but in Spanish. So we have realized that not everybody speaks English, obviously. So there's a framework for Spanish-speaking people as well to know the symptoms of stroke. So because of a lot of the work that we've done at the American Heart Association, we realize that there's still so much work that can be done. But because of the research and the funding and all the work that we've done since 1924, which is when we were founded, deaths from cardiovascular disease have been cut in half, which is phenomenal. Like I said, we still have a long way to go. There's still way too many people dying of heart disease. But this is showing that the research is working. And then I included this in here just because sometimes it's really cool to see, like, overarching what the Heart Association does. Especially locally, we don't always understand the emphasis on research. We're at a college, so it makes sense for us. Like, we think that the research is important because we do this every day. But a lot of people think, oh, I don't want my money to go to research, or they'd rather see somebody locally impacted. But this shows that the research is making a difference. So, for example, the pacemaker. We all know somebody that has a pacemaker. The American Heart Association funded the research that came up with the pacemaker. We were started by 6 cardiologists. We had the first successful heart valve replacement. I'm not going to go through all of these, but this just shows some of the things that have been happening over our 100 and almost 2 years as an organization now, and the things that we've been doing. Same thing here. Go Red for Women was launched in 2004, and that came out of the fact that clinical trials up until about 2003 or 4, women weren't included in clinical trials. So women were dying at a disproportionate rate of heart disease. I wonder why. We're not studying women. Our genetic component is different than that of a male, so why don't we study that? That's probably important. So Go Red for Women was launched to say, hey, women are important too. Let's figure out why they're dying of heart disease. And we still have that campaign today. We have one in the Triangle. If you've been to a basketball game lately, the cheerleaders wear red ribbons during Heart Month, and that is for heart disease, for Go Red Month. So February is obviously Heart Month. It's Valentine's Day. It makes the most sense. So that's what we do that for. We put out new blood pressure guidelines every few years. We just released some more this year. And then in 2024, that was our 100th birthday as an organization. And we're still trucking to this day. So again, research, I wanted to include this nugget because this is something that I feel like we don't think about a lot, but the American Heart Association gives out research funding every year. And North Carolina is heavily represented in researchers that are funded. There's 2 at ECU that are receiving funding right now for various research. They get it every year. So this is just an interesting tidbit for anybody that's in the public health program or nursing program or whatever. If you're interested in research, this is an opportunity that's available to you that you might not have known about. If this is something that you're interested in, if you're interested in anything that has to do with cardiovascular disease, stroke, there is research funding that you can apply for, and a lot of North Carolina universities get it. But we have 14 scientific journals that are published by the AHA and the Stroke Association. We have a scientific sessions, which is really cool. They do it every year, where a lot of researchers get together and talk about what the research is, what we're going to do, how our guidelines are changing, things like that. This is all kind of national level stuff, but we do have some local people that go and attend this each year. Our Get With the Guidelines program is what hospitals participate in. So essentially, we give hospitals these guidelines and say, this is what you should be doing in the treatment of heart disease and stroke and hypertension, things like that. UNC Health Nash and ECU Health Edgecombe both participate in this program. A lot of hospitals participate in this program. I think there's only one locally that I know of that doesn't participate and Get With the Guidelines. So 87.6% of the U.S. population has access. It's probably even higher than that in North Carolina because a lot of the hospitals do come to the Heart Association and say, hey, we trust your guidelines, we trust your framework and your research, so they follow that at the hospital. We also have it in clinics, in the clinical setting, so it depends on what you ask for. So if there's anybody that has a connection to clinics and you think this would be beneficial for them, please let me know. Same thing with any of the research, anything like that. I might not have all the answers, but please reach out and I can connect you to somebody that does have all the answers. This is the part that this is where I get really passionate about the Heart Association, and where, if you've seen me in a class or if you've taken my class, rural health is something that's really important to me, because it's where we live. These are the people that we interact with every day. So these are kind of our impact priorities for the American Heart Association. Go Red for Women has been added recently. Women's health is very important. I'm very passionate about that as well because, like I said, we deserve health care too. Why not? Nation of Lifesavers, that is what we have kind of taglined our CPR training. So we want to turn bystanders into lifesavers. If you see somebody have a cardiac arrest, we want you to be able to act and not be scared. So taking that stigma away that you're going to hurt somebody or that you're going to get in trouble. So we're trying to turn everyone into a nation of lifesavers. Stopping tobacco and vaping. I know that that is a touchy subject around here because we do have a lot of farmers that farm tobacco. So I know that that's people's livelihood. But eliminating nicotine. I mean, obviously, that's a really easy way to try to prevent heart disease and stroke. Controlling your blood pressure, giving people more access to being able to check their blood pressure, and then nutrition security. So do we live in a food desert? There's a lot of those around here. Can we get healthy food? How do we get healthy food to more people? And affordable healthy food? How do we get it in the hands of everybody, not just those that can afford it? Rural health crisis. So since the mid-1980s, the gap between rural and urban death rates has expanded. If you live in a rural area, your life expectancy is 3 years less than somebody that lives in a metro area just because of what your zip code is. And that is heartbreaking, and it shouldn't be like that. There's a variety of reasons why it is like that, but we're really trying to combat the rural health crisis and give everyone access to health care everywhere and make everybody everywhere have a better life. And then again, you're more likely to have and die from cardiovascular disease if you live in a rural area. So what can we do to stop that? So now I've talked about kind of our national stuff. I'm going to talk about what we're doing locally and how we're making an impact on people that are here. And if you have a question at any point, stop me and I will answer it. This is our team in Eastern North Carolina. We are small but mighty. We cover 33 counties. There are 3 people that are development directors, myself included. We have a community impact director, which is the only one in a rural market across the country. The Heart Association realized that we're doing so much locally that they gave us a staff person to implement these things. So very proud and excited about that because we are doing so much locally. And then we have an event planning coordinator and a data coordinator. So the 3 biggest target areas for the Heart Association in Eastern North Carolina, and the 3 areas we can make the most tangible difference, are through hypertension control. So that's blood pressure screenings, blood pressure stations, CPR training, getting more people trained in CPR, and through workplace wellness. So those are the 3 areas that the 3 of us can go in and really make a difference. So that's kind of our priority areas. That's not the only things that we do, but those are the areas that we know that we can work with somebody and make a difference. So we've done things like last week, we took a blood pressure station to Station Square in Rocky Mount. So it's a station that's going to live there. People can go in, anybody can use it. They can check their blood pressure. So if you go to the doctor and they tell you need to be monitoring your blood pressure. Okay, cool. I don't have a blood pressure cuff. I don't have money to go buy a blood pressure cuff. This is a place where you can go and you can sit for free, check your blood pressure. We give you a little card where you can write it down. And then it has the clinical connection as well. So it tells you, you scan a QR code, it says, okay, my blood pressure is 120/80. That's good. If it's not good, it'll say, okay, you can go to this place, and this place locally that are free resources for you. So then you know what to do after that. We don't just say, oh, your blood pressure's high. Good luck. Hope nothing happens. We then give you that clinical connection as well. We also are working with the libraries. The library in both Edgecombe and Nash counties are going to have a Libraries with Heart program, which means you can go in and check your blood pressure there, or you can check out a blood pressure cuff just like you would a book. So you can go in and say, hey, my doctor told me to monitor my blood pressure. They give it to you, you keep it for 6 weeks, and you turn it in at the end just like you would a book. So the name of the game is giving more people access. So that's what we do with blood pressure. Same thing. These are what our little stations look like. They're super simple. They're very easy to implement. So we do a lot of this. Same thing with CPR. So can we get kits into the hands of more people everywhere? So in 8th grade, you're supposed to be trained in CPR. That's all well and good. If you don't have a CPR kit, how are you going to actually be trained in CPR? So trying to get more kits into more middle schools so people can check off that box for graduation and actually learn how to do CPR. Same thing with our model at the Heart Association is to work with organizations that are already doing the work. There's only 3 of us. I can't reach but so many people. But if I can work with an organization that's already in the community and is community facing, can they train more people? So the biggest example of that and the thing I'm most proud of is our farm worker initiative. It's the only one in the country, and we are working with farm workers because in 2023, there were 7 farm worker deaths in Eastern North Carolina due to cardiac arrest. And it's for a variety of reasons. So when you call 911, there may be a language barrier. You're in the middle of a field somewhere and you can't tell the dispatcher where you're at, so it takes them longer to get to you. You don't know CPR. You don't have an AED on your truck. So a variety of things that could lead to farm worker deaths. So we've worked with Access East and Salute San Fronteras, and we gave them a CPR kit. They're these big rolling suitcase kits. They have 10 mannequins in them, and they're supposed to last like 5 or 6 years. Train thousands of people, last 5 to 6 years. Like, they're really nice kits. The guy calls us back like 2 months later, and he's like, we're busting the heads off of these mannequins. And we're like, are you sure you're doing it right? Like, they're supposed to last you a long time. What's going on? So we start asking questions and doing more digging, and we're like, how many people have you trained? Like, how many have you used these kits on? This man had trained 5,000 people in CPR in 2 months since we gave him that kit. So these are the people that we're partnering with at the Heart Association because he had access to those 5,000 people that we didn't have access to. So we're not going to hold all the resources. We're going to give them to him. We trained him. He could train his people. And we found out they have a warranty on them. So we were able to replace the mannequins, and he's been able to train more people because of it. So that's just a good example of how we do the work at the Heart Association. Here's some pictures. Those are the rolling suitcase kits. Like, they're big, massive things. They come with all the information in them. They have a facilitator guide in there. So it's literally, we hand it to you. You don't have to do anything else except read the guide, and you can train people in CPR. People ask how they can support. We have a Heart Walk on campus. It's going to be September 27th this year. So glad that it's on campus. Come volunteer, show up, tell people about it. You don't have to just donate money. Our mission is funded through volunteers, and our mission is moved forward because of volunteers. We can't do it by ourselves. So just showing up is enough for us. And then advocate for healthy policy. So public health is health. How can we make our community healthier? Share the resources that the public health department puts out, that the nursing department puts out. Like, try to get your community healthier. And then this is how in Eastern North Carolina we fund our mission. So we do so through foundations, but we also have events. Like I said, Twin Counties Heart Walk is on campus in September. We also have the Greenville Heart Walk in October. We have the Cape Fear Heart Walk in Wilmington, and then we have 3 heart balls, New Bern, Cape Fear, and Greenville. And this is how our mission's funded. So last year for Twin Counties, we raised over $101,000 for the Heart Association just through the Twin Counties Heart Walk, which was the best year we've had probably ever, to be completely honest. New Bern Heart Ball was 2 weeks ago. We raised $160,000 in the room to total over $231,000. So this is how a majority of our funding comes in, and where most people are exposed to the mission of the Heart Association. I just like word vomited for 32 minutes. So I'm going to open it up for questions. Don't feel like you have to ask any questions, but happy to talk about public health, about the Heart Association, about what you can do locally. If you have any questions, ask me.
Hey, Tonia, it's Evan.
Hi.
Hope you are doing well. First, I want to say that I appreciate the work that you do, not only in our community, but with our students and with our public health program. You have more energy probably than I will ever have. So I appreciate you showing up and doing all the things that you do. My question is about one, I am happy to see the emphasis on sleep. I think more and more people, experts and researchers and influencers are talking about the importance of sleep in overall health. So that's great. Does the Heart Association advocate, though, there are some tests, screenings that can be done for stroke and, pictures of your arteries and different things, but it's not something that's part of, um, it's not part of routine scannings like a colonoscopy and different things. Is there any advocacy to kind of include that in our, kind of yearly checkups, versus paying out of pocket?
Yes, I think that is one of the biggest things. Our advocacy team, so we have somebody in Raleigh that only works with legislatures and sends out stuff on behalf of the Heart Association saying, this is what our research says. Can we do something about it? A big part of that is insurance and Medicaid expansion and getting more people these tests. So yes, it's absolutely a priority is getting more people screened. Especially like the research shows some of it is genetic. Like I said at the very beginning, a lot of this we can control, but there is a genetic component to it. If it's in your family, you should be screened for it. And there are some things you can do if you have a family history now that insurance will cover, kind of like mammograms. If you have a history of breast cancer in your family, you can get mammograms earlier. So I think an interesting tidbit is always talk to your doctor and talk about your family history, because that is important and they can sometimes work with you to get through that routine screening not covered by insurance. But yes, that is a huge priority for the Heart Association is trying to get more people not only access, but healthcare in general.
Perfect. Thank you.
And North Carolina Wesleyan is getting one of these big rolling suitcase CPR kits. So I'm going to be texting you about a photo op for that. So we will be able to train students in hands-only CPR. And if we have somebody certified, they can certify some people too. So
I love that. Thank you.
Happy to be able to do that too. Any other
Tonia,
questions?
Yeah, I wanted to make a comment about your blood pressure stations that you brought up. Just one thing that I don't know if everybody caught that, but I thought it was really, really important that you all are going beyond just here you can get free blood pressure screenings, but then actually offering resources for them to go to, should they have, a higher number or whatever it is. I think that second part is often lacking when we're trying to do interventions. And so I really appreciate that there's that follow through.
Absolutely. And that's where it's so important for us to be in the community too, because it doesn't work without that partnership. So I can't send people to OIC in their van if they have no idea what's happening. So letting them know not only that there is a clinical connection, but then letting OIC know too, hey, they can go get screened at the library. If you tell somebody that they need to go get checked, this is a resource for them as well. So that's really important to us is on both sides of that, like working with the people to say, here's your connections, but also working with the connections to say, how can we help? What else can we do for you too? So that's part of our model too. Any other questions? No pressure. Well, I invite you all to come to Heart Walk in September. We've got a little bit before then. If nothing else, say Happy Heart Month on Facebook. Share it with your people. Let them know that we're talking about health. And if you ever have any questions, reach out to me. That's my cell phone number. I also have a Wesleyan email that you can reach me at. If you want to learn hands-only CPR, I keep a mannequin in my car. If you don't know how to do CPR, I'm happy to show you how to do it. We can go through it. It takes 30 seconds. Same thing with the AED trainer. Always happy to do that as well. There's actually a competition going on this week where we're part of this race cars trial across North Carolina, and they're trying to break the world record of number of people trained in hands-only CPR. And it's like 30,000 people have been trained at one time. So they're trying to break that record. So if you want to learn, let me know, and I will teach you, and you could be added to that number so we can break a world record. You could be a part of something bigger than yourself.
I just
Thank
want to
you
say
so
thank you so
much.
much. Yeah, I know. Thank you so, so much. This was awesome.
You are welcome.
All right. If there are no more questions, again, thank you, Tonia, for your time today. We really appreciate it. You had a really good crowd. And so we appreciate all your energy, all your information, and thanks for being with us today.
Absolutely. Thank y'all for having me. Go Bishops.